would you recommend any test to be done? What blood tests need to be done as
asymptomatic patient, completely asymptomatic, like somebody in the house was positive, because somebody in the house was positive, everybody else got tested, and somebody who had no suspicion, no symptoms, no signs is positive, you don't need to do any blood test for them. Please don't do any blood test for them. If you have symptoms, then it is probably important that you do at least CBC, CRP, and D dimer on the 4th or 5th day of your illness. And then if they're abnormal, repeat them again by 7th or 9th day. That's what you need to do if you have symptoms. If you have comorbidities, then along with CBC, the CRP, and D dimer, you need to do relevant investigations which might show up your comorbidities, how well controlled they are. So for a diabetic, it might be important to do an HbA1c and a fasting and a post-parental blood glucose, because we know that sugars can take a hit. For somebody who has kidney disease, I always like to add a creatinine to understand what is happening. Somebody who is a heavily diabetic also, I would like to add a creatinine. But the attitude and the approach now is towards minimal investigations. No ferritin, no LDH, none of those things we do nowadays. The only simple 3 investigations which we rely on is CBC, CRP, D dimer. I am finding that some of the asymptomatic patients also are having high D dimer, but they're completely asymptomatic, so we don't do anything for them. And within the next 4 or 5 days, the D dimer comes down, unlike what we were seeing before. Before, D dimer used to take weeks together for it to normalize. Now we are seeing it come down very quickly, almost like an acute phase reactant. No tests are needed in asymptomatic. Let me repeat myself. No tests are needed in asymptomatic. Only if you have symptoms, you do it, please.